Open Eyes presents the U.S. healthcare industry, changes and opportunities. Part 1, Introduction. News about U.S. healthcare has been dominated by screaming pundits from both the left and right. But the heated rhetoric has often obscured the key characteristics of a fast-changing $2 trillion industry. Healthcare is delivered by a complex network of actors. The relationships and tensions between these actors defines how profits are distributed in the healthcare industry. Because of Obamacare and a host of other factors, each relationship is evolving in a way that creates new opportunities for job seekers, entrepreneurs, and existing firms. Many jobs that exist in the healthcare industry today will not exist in 5 years. Many jobs will be transformed beyond recognition. New jobs will be created in emerging sub-industries requiring skills and expertise that very few people have. This period marks a time of great change and opportunity in the U.S. healthcare industry. Recent changes have been driven by the need for solutions to two big problems. The first is high costs. The United States has the most expensive healthcare system in the world. Let's compare spending on healthcare by country. In 1980, spending in the United States was similar to that of other OECD countries. But spending in the United States grew much faster, reaching a level today of over $8,000 per person. This level of spending is due to both private and public contributions. Let's look at healthcare spending as a share of GDP. In most OECD countries, healthcare spending represents 9.3% of the total economy. Out of that 9.3%, 6.7% is public or government spending, and 2.6% is private. The comparable figures for the United States are startling. Public government spending represents 8.4% of total GDP, while private spending accounts for an additional 9.2%, bringing the total to 17.7%, almost double the OECD average. The second problem is that there are too many uninsured Americans who live without health insurance. Out of the total U.S. population, 54% have private insurance, either from their employer or paid for themselves. 30% have government insurance from programs such as Medicare or Medicaid. 16%, or 49 million Americans, have no health insurance. These two central problems, number one, high costs, and number two, too many uninsured, are due in part to the way the healthcare system is organized.